Rhinoplasty is one of the more popular cosmetic surgeries around, and recently I sat down with Dr. Daniel E. Rousseau at his practice to learn more. So we're talking about rhinoplasty. What is rhinoplasty exactly?
Well, rhinoplasty procedure is an operation that deals with changing the structure of the nose. The nasal components include cartilage and bone. Sometimes we have to do some work on the cartilage alone, and sometimes it requires some bony work as well.
Who's an ideal candidate? I mean, who's coming for rhinoplasty?
Well, rhinoplasty typically is done to change the shape of the nose, to improve not only the appearance of the nose, but sometimes the function of the nose too. So some patients have had injury, they've had automobile accidents or sporting accidents, so they've broken their nose, they can't breathe well through their nose, so we have to do some surgery to not only straighten the inside of the nose, the septum, which many people have heard of as septoplasty if they have problems breathing through their nose, but sometimes they need to have the outside structure of the nose repaired as well, and that's typically the type of person that we see if they have had an injury. Others have never had any injury, and they just want to improve the appearance of the nose.
And how much does age have to do with it?
Well, obviously, there are some people that when they get to be a certain age, young women, young men, that will start to have a noticeable deformity of their nose that they want to have it fixed. The earliest that we typically will do a patient like that, young man around 15 years old, young ladies tend to mature a little bit quicker, and sometimes as early as 14 years old we can do a young lady.
How much pain is involved?
Well, luckily there's not that much pain with this procedure. We used to pack the nose many years ago, and that made it very uncomfortable for patients after the surgery, but we don't do that anymore, and I've not done that for many years. We use a special suture that's dissolvable that does not require any nasal packing, so the patients don't have that much discomfort. They feel like they've got a cold typically for the first week after the surgery. It's a little stuffy, a little bit sore, but not very much discomfort with rhinoplasty typically. Well, I tell patients they need to take it easy for about 2 weeks after the surgery. There's a little splint on the nose that sits on the bridge of the nose for the first week, and after the first week that splint will come off, and the patients can get back into their normal routine in about a week in terms of activities that are not very strenuous. The biggest risk to a rhinoplasty procedure is the possibility of a nosebleed after surgery, and we tell the patients to take it easy for the first, like I said, 2 weeks after surgery, and that risk is very small as long as they take it easy. The other really significant potential risk is that they're just not going to be happy with the results of their surgery, and that's why we really spend a lot of time with our patients discussing the desires that they have prior to surgery. We'll use the computer imaging system, the television, and the video monitor, and we'll make changes on their face to kind of give them an idea of what they would like to see after their surgery. And typically, if it's something that I feel very comfortable that we can deliver, then the patients are very happy after surgery.
We'll be back with the final check on your forecast. It's next. Do stay with us.